resources, surgeons, vaccines, drugs, CT scan, MRI, fund, all of them are resource generation. So these are the resources, and one of the main function is to do resource generation, yes, to provide them for the country. So this is the main duty and the main role and the main function of any health system. So any health system should provide
More resources.
all these resources. And when we talk about providing, for example, MRI or CT scan or vaccine or drugs, we don't necessarily mean produce it. So that's not the duty of, not necessarily the duty of health system or Ministry of Health to produce it, maybe buy it, maybe import it, okay? And maybe not by itself, maybe indirectly, for example, by other people, so who provide medications? Companies, yes, private companies. But they should do some rules and regulations and monitoring and evaluation and financing and so on and so forth, that at the end of the day we don't have lack of medication, we don't have lack of lab exams, we don't have lack of human resources. So this is the duty of health system, to provide all these resources. So we need these inputs. So the first duty is to provide them. So resource generation, one of the important functions. And just providing is not enough. So you provide doctor, nurse, medication, hospital, ICU, CCU, you provide all of them, but you don't deliver. So you should deliver the care aspect, yes? Provide resources, resource generation. Deliver health services, before that to do financing, because without financing you cannot do them. And in addition to them, to do good governance and good stewardship and good leadership. Because if you don't do good governance, you will not be able to provide them, and you will not be able to achieve this goal. Why? Let me give you one example. Suppose you go to a supermarket and you ask the person, sorry, I don't know what I need, I don't know which of these, for example, materials and stuff I need, I don't know how many I need, I don't know the quality of them, and I don't have any idea about the price of them. You think and you decide which of your stuff I need, put them together in a package and give me to take them home and use them, and at the end of the day somebody else will come to pay the price. So what happens if you do this way? So you go to a supermarket, say I don't know what I need, how many, which quality, which price. You just select something for me, give it to me, and I will use them. You take them home to use them and say somebody else will come to pay for that.
So there's no good management.
So without governance, this happens. And in health system, if you do it, definitely you will fail. The system will fail. It's like you go to a doctor and you say, sorry, I have some pain and I have some discomfort and I have some sign and some symptoms, but I don't know what's the disease and I don't know which medication I need or which surgery or procedure I need. And if you do operation or give me medication, I don't know about the quality, the effect, the performance, the price. You give it to me, I take home to eat, and then the insurance company will come to pay for me. So what happens then? The patient wants to use more services. The doctor wants to give you more services, because income and payment, okay? And the insurance, they will be forced to pay the price but will not be able to afford it because more people come and want more procedure and more doctors they want to give the procedures, and at the end of, so if you don't have governance means regulating them, yes, overseeing them, regulating them, and making policies, policy making, monitoring, accountability, transparency, responsibility, regulation, all of them comes under the umbrella of
Leadership.
governance and leadership. So without governance, the system will definitely fail, especially the health system. So this means maybe the first maybe function will be then governance, then maybe the financing, then maybe the resource generation, and then maybe the service delivery. So we became familiar with the main elements of any system: input, process, outcome, or structure, process, outcome, or structure, functions, outcome. So we became familiar with the inputs, we became familiar with the functions or processes, and we became familiar with the goals, starting from primary objectives and goals to the intermediate one to the final one. And in the final one, we normally put health and we normally put satisfaction as well. They say patient satisfaction is also more ultimate goal rather than intermediate or primary goal. So this is to become a little bit, because the first session of this course is to become familiar with the concept of health. Inshallah, next session I will bring the slides. I will overview the slides for the first session, and then we will move to the next session, and I will give you the references as well and the other materials and elements as well. But for the moment, you became familiar with the concept of health, with the concept of health systems, and with the dimensions of health system, different dimensions of health system. Inshallah, next session we will move to some further concepts, like how we can measure and how we can, for example, the criteria for measurement and the method for measurement of health and the performance of health system. So I should take these.